Jeff came in complaining of a long history of shoulder pain that had progressed to such a point that it was interfering with his activities of daily living and keeping him doing the things that he wanted to do and more so needed to do.
I just had a scratching in my shoulder that just got worse and worse. Started on my left side and it would get hung up. It would actually rub so bad that I would get a frozen shoulder reaching for things.
He was very active. He wanted to try to maintain his lifestyle, but at the same time, eliminate the pain. We always try to take a conservative route. We talked to him about medication, anti-inflammatory medications, and even pain medication, but Jeff did not want to take pain medication, and he had taken anti-inflammatory medication without relief.
That pain on the left side got worse and worse, and also through playing guitar and piano and some other activities that I love to do, there was just, I had to keep looking for a way to correct it and didn't know what was out there.
A total shoulder is a good operation for pain relief for a lot of people. While they do get good pain relief, they'll tell you that they don't have the function that they would like as far as the range of motion. And the Arthrosurface is a procedure that, restores the anatomy more predictably. And while at the same time eliminating that component that causes the pain, the arthritic surface.
The procedure was more simple than I could have imagined. It's very easy surgery. It went so smoothly and I was able to recover quite quickly.
Jeff did so well that he mentioned to his brother, who had a similar condition.
Well, my son and I throw a lot of balls. He's a quarterback at one of his schools, and so we throw an enormous amount of footballs. And I also do a whole lot of construction. So my joints are working all the time. And in football as a kid, I dislocated both of them. So eventually they rolled around a lot and it would knock, and it was a real problem.
He had developed arthritic shoulders and was symptomatic as well. Like Jeff, he too wanted to maintain an active lifestyle.
The pain got so bad that I became a left-handed thrower than a right-handed thrower because I didn't want to give up on what I was doing. But finally it got to a point to where both of them were rattling around inside my joint so bad, and the pain was just excruciating, that I had to do something about it. My brother Jeff had the surgery probably 2 months before I did. So he was able to get in there. He was kind of the guinea pig in this thing, but he was doing so well. And the mobility that he had, it was like, I've got to schedule this instead of procrastinating and put this off any longer. My life has changed after this procedure with the fact that I have all the strength that I had as an 18-year-old. To be able to throw the footballs, to be able to catch the footballs and softballs, do all the active things that I enjoy doing, I have all of that back completely, 100% and I have zero pain.